Hi, how are you all? Today I came with a new topic, fluid and electrolyte imbalance. Let us start the topic. Fluid and electrolyte imbalance are a common medical conditions. It occurs with the different regions. For example, in case of excess sweating, vomiting, diarrhea, kidney disease, and certain conditions, we can observe this fluid and electrolyte imbalance. In this presentation, we'll see about the definition, pathophysiology, signs and symptoms, and nursing management. How we'll treat this fluid and electrolyte imbalance. First of all, what do you mean by fluid balance? Here, the human body mainly consists of 60% of water. It is divided into various fluid compartments that include intracellular fluid and the extracellular fluid, which involves interstitial fluid and the plasma. This fluid balance helps to maintain the regulation of water intake and output between the two compartments. The kidneys plays a major role in case of fluid balance. In order to regulate the urine output or conserve the water or excrete the water whenever needed. Then, coming to the electrolyte balance, these are all the electrically charged particles that are dissolved in the body fluids that mainly include sodium, potassium, chloride, calcium and magnesium. This electrolyte balance helps to regulation of the particles in the body that is critical for proper nerve and the muscle function, which helps to maintain the fluid balance. In this case also, kidneys plays a major role in order to regulate the electrolyte balance. Thus, it helps to excrete the excess electrolytes or if whenever needed, it can retain them. Different types of fluid and electrolyte imbalances. Hypovolemia, hyperolemia, hyponatremia, hypernatremia, hypokalemia, and hyperkalemia. Hypo means there will be decreased, whereas in hyper there will be increased. So, in case of hypovolemia, what happens? There will be a decreased blood volume due to the loss of fluids. If in case of excess fluid intake or retention, what happens? There will be the increased blood volume. If the decreased blood volume takes place, it leads to hypovolemia. Whereas in hyperolemia, what happens? Increase in the blood volume will takes place. In case of hypovolemia, the main clinical manifestations are thirst, dry mucous membrane, decreased urine output and hypotension. Whereas in hypervolemia, what happens? There will be edema, shortness of breath and hypertension. That is hypovolemia and hypervolemia. Next, coming to hyponatremia, there will be the decreased sodium levels in the blood. If the increased sodium levels in the blood are seen, it leads to hypernatremia. In case of hyponatremia, the main clinical manifestations are headache, nausea, vomiting, seizures, and coma. Whereas in hypernatremia, there will be the increase in the sodium levels, so it leads to thirst, restlessness, weakness, and the seizures. Next type, hypokalemia, there will be the decreased potassium levels in the blood. If we perform the blood test, we can observe the decreased potassium levels. The normal potassium levels are 3.5 to 5.5. If there will be decreased potassium levels are observed below 3.5, we can see hypokalemia. If the potassium levels raised above 5.5, it leads to the hyperkalemia. Hyperkalemia means there will be the increased potassium levels in the blood. In case of hypokalemia, the main signs and symptoms are weakness, cramping, and cardiac dysarrhythmias. There will be the muscle weakness will be seen. Whereas in hyperkalemia, as there is increased potassium levels, we can see the muscle weakness, cardiac dysarrhythmias, and as well as paralysis also observed. Next, signs and symptoms of fluid and electrolyte imbalance. In case of fluid imbalance, what happens? There will be the dehydration or overhydration. In case of decreased volume, there will be the dehydration. Like we can observe dry mouth, thirst, decreased urine output, dark yellow color urine, fatigue, headache, dizziness, confusion, dry skin, sunken eyes, and rapid heart rate. As there is a decreased volume observed in the uh, body, there will be the different symptoms such as dehydration. And in case of overhydration, if there is a over accumulation of fluid or overhydrated means there will be the weight gain, swelling in the legs, hands or face, bloating sensation, shortness of breath, rapid heart rate, headache, nausea and the confusion. These are all the main signs and symptoms can be observed in case of fluid imbalance. Whereas in electrolyte imbalance, the calcium levels may be increased or decreased, and the potassium levels also increased or decreased. In case of decreased calcium levels, it leads to hypocalcemia. Here we can observe the numbness and tingling in the fingers, mouth or feet, muscle cramps, seizures, arrhythmias, hypotension, irritability, depression, and the confusion. Whereas hypercalcemia, what happens here, the calcium level will be raised. So we can easily observe the fatigue, weakness, constipation, nausea, vomiting, excessive thirst and urination, confusion, muscle weakness, bone pain, and the arrhythmias. In case of decreased potassium levels, the hypokalemia will be observed at muscle weakness, cramping, fatigue, constipation, and dysarthrias, as we had seen in the earlier. These all symptoms will be observed. In case of hyperkalemia also, the same symptoms where the hypokalemia symptoms will be seen as same as the hyperkalemia, like muscle weakness, paralysis, and the dysarthrias, tingling sensation in the hands and feet, chest pain, difficulty in the breathing, like dyspnea and all, will be occur. Next, we'll see about the pathophysiology of fluid and electrolyte imbalances. Here, in case of fluid imbalance, what happens? There will be the excess of fluid deficit. If what are the contributing factors that causes the excess or a deficit fluid? In case of inadequate fluid intake, excessive fluid loss, or underlying medical conditions such as heart failure or kidney disease. In case of heart failure or kidney disease, what happens? The heart will be unable to pump the sufficient amount of blood to various body parts or returning to the heart very low amount. So, the fluid imbalance will take place. In cases of fluid deficit, the body, what the body try to do, the body will try to compensate the increasing fluid retention and vasoconstriction. It leads to decreased urine output and increased thirst. Thus, the body attempt to excrete the excess fluid through the increased urine output and the sweating. Next, in case of electrolyte imbalance, what we will see? There will be the excess or deficit of fluids in the body, such as the electrolytes such as the sodium, potassium, calcium, and magnesium. There will be the imbalances. Thus, it leads to different imbalances due to the various factors, including inadequate dietary intake, excess losses through the sweating or diarrhea, underlying medical conditions such as the kidney disease or the endocrine disorders. Here, what happens means the body function will be significantly interrupted because the minerals plays an important role in the nerve connection, muscle contraction, and the fluid balance. Thus, it includes the muscle weakness, cramping, confusion, and the irregular heart rhythms. Ultimately, due to the different factors, what happens? There will be the underlying medical conditions and the different body functions will be impaired in this condition. How we can diagnose and how we will assess this fluid and electrolyte imbalance. First, if we consider the patient's history, we need to ask for their medical history such as chronic illness, any use of medications or recent surgeries or procedures, whether they had undergone in the past, or any information about the fluid and electrolyte imbalance. We need to completely ask the patient history. In case of physical examination, we need to observe for the skin turgor, any edema, and abnormal heart or the lungs. Through this, Through these changes, we can able to identify the patient who is suffering with fluid and electrolyte imbalance or not. In case of laboratory tests, we need to assess for blood test and urine analysis. It will provide the information about the what are the electrolyte levels in the body and how the kidneys are performing its function. Next, the imaging studies or the electrocardiogram, we can able to identify any cardiac dysarrhythmias. And in case of imaging studies such as X-ray and all the any fluid accumulation around the lungs and all, we can easily identify. In case of nursing management, what we need to identify, we need to generally identify what are the contributing factors that result in this fluid and electrolyte imbalance, and we need to completely ask for the history and what happens if the what we need to provide in order to prevent the further complications. First step in managing this fluid and electrolyte imbalance, we need to assess and diagnose the problem. We need to ask for the complete patient history, and we need to perform the physical examination and appropriate lab tests. Then, second one, we need to monitor the vital signs, intake output, and daily weight. If there is any weight gain or weight loss, we need to identify them. Then, in case of laboratory studies, any changes in the electrolyte levels, arterial blood gas analysis, and urine output measurements. These are all the things which helps us to provide the main information about the fluid and electrolyte imbalance in the body. Thus, according to that, we can able to treat the situation. The treatment and management includes the underlying cause and the severity of the problem. Here, we need to closely observe the healthcare team to develop the appropriate plan of care. The treatment mainly includes the fluid and electrolyte replacement therapy. If the potassium levels or calcium levels are according to the laboratory test, whatever levels are raised or decreased, we need to treat that according to the patient's condition, medication management, and the dietary modifications. How will prevent this fluid and electrolyte imbalance? If the patients who are at risk, like elderly patients or any person who is suffering with the chronic illness, we need to educate the patients and family members regarding the importance of maintenance of fluid and electrolyte imbalance. And we need to encourage them to take the healthy diet and limit the alcohol and caffeine intake and encourage them to drink the plenty of fluids. We need to monitor the patients. Some of the patients, if they are taking some medications which can interrupt that fluid and electrolyte imbalance, and we need to adjust their plan of care. According to the patient condition, we need to adjust the situation by formulating the proper care plan. Then, nursing management, if you'll see, according to the condition. In case of hypervolemia, there will be the excess fluid accumulation. We need to treat with by monitoring the intake and output, including the fluid balance and maintaining the intake and output chart and the daily weights. Administer the diuretics. We need to observe for the prescription order to promote the fluid excretion. Administering diuretics such as the Lasix and all, then restrict the fluid intake. If the patient is having some renal failure and decreased urine output at all, we need to observe for the physician order and restrict the fluid intake. In case of hypoglycemia, what happens? There will be the decrease in low sodium levels in the body. So, here we need to restrict the fluid, sodium replacement, and treating the underlying cause. In case of fluid restriction, what happens? the nurse should restrict the patient's fluid intake. It prevents the further dilation of sodium in the blood. Whereas in case of sodium replacement, if the sodium levels are critically low, the nurse need to administer the IV sodium replacement. If the hyponatremia caused by the excess vomiting, diarrhea, or medication use, the fluid and electrolyte levels must be closely monitored to ensure when that will be returned to the normal levels. And in case of hypernatremia, what happens? Here, there will be the elevated level of sodium in the blood. So, in order to treat that one, we need to assess the patient's fluid and electrolyte status, encourage the to take the increased fluid intake either orally or through the IV fluids. We need to continuously monitor the vital signs, neurological status, urine output for signs of any improvement, or the condition is further deteriorated. And if the physician ordered some medications, we need to administer the diuretics or the hypotonic solutions in order to correct that electrolyte imbalance. In case of hypokalemia, in case of hypokalemia, there will be the decreased level of potassium in the blood. So, we need to treat the underlying cause. It includes, we need to encourage them to take the potassium-rich foods or providing potassium supplements like K-band powder and vitamin P provided in order to maintain that potassium levels. We need to educate the importance of maintaining the adequate potassium levels. In case of hyperkalemia, there will be the more potassium levels in the blood. So, continuous monitoring of potassium levels at ECG readings and administering the medications such as insulin and glucose, restrict the potassium intake and avoid the potassium-containing medications and the supplements. So, in this condition, we had seen about the different types of fluid and electrolyte imbalances and what are the diagnostic findings we need to assess and how we can be able to manage and treat that condition in case of different electrolyte imbalances.